So a lot of this, if you're looking at it from the patient perspective, it's going to have to do with the assessment of the pain itself. What type of pain do you think it is? Somatic, visceral, neuropathic pain. How severe is the pain? You could look at, is the patient likely to adhere to therapy? Can they physically manipulate a drug delivery system, such as a transdermal patch, for example? You have to look at the patient's organ function. How's their kidney function? How is their liver function? You look at their age. Older adults, if you look at pharmacodynamic differences as we age, they're going to be more sensitive to the effects of an opiate, which tells me to start much lower and go more slowly as we're increasing the dose. So things about that patient that you have to consider when you go to pick a particular opioid. History of allergy, for example. Comorbid conditions. If I have a patient with an advanced cancer such as lung cancer, and I have to worry about dyspnea, which is an uncomfortable awareness of breathing, I would be more inclined to pick a drug like morphine, which has been shown to be not only very effective with pain management, but very effective in treating dyspnea as well, shortness of breath. Methadone, on the other hand, is a wonderful drug for pain, but doesn't bring much to the table in treating dyspnea. I look at, is it persistent pain? Does the patient have pain that is there all the time? Or is it a pain that comes and goes? Or is it persistent pain with a pain superimposed on top of that? That helps me pick not only the opioid, but the delivery system. So if someone has around-the-clock pain, they should be on a long-acting opioid, whether it be a once or twice a day tablet or capsule, a 3-day transdermal patch, a 7-day transdermal patch. That helps me pick that baseline drug. And then once you've got your baseline drug in place, if they have breakthrough pain, you want to pick a drug that's going to kick in fairly quickly to chase that breakthrough pain. It could be morphine or oxycodone oral solution. It may even be, if we can afford it, the transmucosal fentanyl products, such as the Actic or the generic Actic, the Fentora effervescent tablet. We have a few more on the market as well. They kick in much more quickly. So for people whose breakthrough pain comes on quickly, you want to match up the characteristics of the patient and their complaint to the characteristics of the drug.